This is Dr. Christopher Meyer with Florida Vein Care Specialists. This is an example of a EVLT of a Cocketts perforator. At the beginning of the procedure, we're looking for the fascial defects. A perforating vein is a vein that goes from the deep to the superficial and has refluxing blood going from deep to superficial as well. So what we're looking for here is the break in the fascia to help show us where the perforating vein is. Once you've found that perforation of the fascia, you want the superficial portion of the perforating vein to be pointing to the left side of your ultrasound screen, because that's what side the needle is going to be coming in on when you are actually trying to access the vein. So here we have a spinal needle with the perforator fiber. You want the fiber to be extending beyond the tip of the needle by 2 to 3 millimeters. So here we're measuring the fiber and we're going to position that so that it's 2 to 3 millimeters beyond the end of the needle. Now we're repositioning our ultrasound probe over the perforating vein, and again we're going to try to get the superficial part of the perforating vein pointing to the left side of our ultrasound screen. And we're going to access this perforator through a longitudinal view. You can see the superficial portion of the vein is pointing to the left side of the screen, and we are going to try to get our needle tip in the same frame that we're looking at here with the ultrasound. So we'll insert our spinal needle longitudinally underneath the ultrasound probe and try to position the tip of the needle in the correct plane in order to access the perforator. So here we can see our needle tip coming into view, and we're passing our needle tip down toward the fascial defect, and we're trying to enter the vein. Probably 90 to 95% of the time you'll get a flash of blood here. In this case, for some reason, even though we're look to be in pretty good position, there's not a good flash of blood, but it's really not necessary. You can still ablate these perforating veins without being inside the lumen of the vein, as long as you're close to the vicinity. The other thing that you want to keep in mind when treating perforators, especially Cocketts perforators near the ankle, you want to make sure that you're not positioning your needle into the posterior tibial vein. So always be cognizant of what the deep vein is that's being treated in the perforator. Most perforators are either Cocketts perforators, which are on the medial portion of the leg, or posterior perforators, which are on the posterior portion of the leg, or possibly lateral perforators. So now we've positioned our needle tip and laser fiber at the fascial defect, and we're placing another spinal needle alongside our perforator fiber and injecting a tumescent anesthesia around the perforator. So we'll make sure that there's adequate tumescent anesthesia, prevent possible neuropathy from any nerves being around the perforator, and also to make sure that the patient tolerates the procedure. So now the tumescent is in, and we're beginning to use our energy source, and you can see the cavitation there where the perforator is being destroyed by the energy source. And we'll basically tap the foot pedal several times until we've had about between 9 and 11 seconds of energy, and usually between 70 and 95 joules of energy in order to close the perforator vein.